It's a scary trend. People in my generation getting colon cancer or rectal cancer. Even scarier, doctors may not even know to look for it.
I was diagnosed with stage 3 colorectal cancer.
At the age of 27, Keisha Wagner couldn't believe what she was hearing. Cancer that may be spreading.
I was worried when they first diagnosed me with stage 3 because that was kind of aggressive to hear at first.
Almost a year before her diagnosis, she was suffering from blood in her stool and extreme intestinal pain. She went to the doctor to get it checked out.
I was diagnosed with hemorrhoids for 9 months. She done exams and she told me they were internal hemorrhoids.
Months later, the pain continued and she went back to the doctor and was diagnosed with the cancer.
In my head, I was thinking in the 9 months that I wasn't diagnosed, could we have caught it earlier and the treatments may have been differently? It's not as hard on my body.
This misdiagnosis is happening more and more. Doctors are detecting the cancer that usually targets people over 50. It's now attacking the younger generation.
Over the past 5 years, I probably have seen 10 patients who are younger than the age of 50. Now, for those who are like millennials, I would say probably 3.
Dr. Andy Chen is a radiation oncologist at Texas Oncology. He says it's unclear why this trend is happening.
Most colorectal cancer presents without any symptoms, and that's the scary part. There's no symptoms at all in the beginning. And especially in a young person, you have a good reserve, healthy, you're able to mask any symptoms.
But if a person does experience symptoms, this is what to expect.
They could develop with rectal bleeding, blood in the stools, or change in the bowel movement, such as constipation or diarrhea. Also, weight loss, unintentional weight loss, fatigue, anemia, changes in your energy levels.
But even with these symptoms in young adults, it's still hard to tell if it's colon or rectal cancer.
The real problem with a young person being diagnosed with colon and rectal cancer is because, first, there's a low index of suspicion, and so their diagnosis and treatment are delayed.
Which explains why Wagner's doctor misdiagnosed her.
The reason she didn't move faster in the referrals was because of my age, because I never thought it was cancer.
Wagner went through a round of chemotherapy and radiation. The treatment got rid of her tumors, but she decided to have surgery to remove part of her colon. Now she wears a colostomy bag.
That don't bother me because in my head it's either live with the colostomy bag or take the chance and risk it.
The effects of cancer never goes away.
I think the first reaction is always some sadness because you realize they carry burden early on. And because it lives, once you're diagnosed with cancer, it lives with you. It's not, you may be cured, but you always live with the burden of cancer.
For Wagner, she's not thinking about that burden.
It didn't change what I do. I love to go out to Zydeco's. I love to ride ATVs. It didn't change anything. You just learn how to cope with it and live with it and keep your head up.
Wagner is in her last round of chemotherapy, and both Wagner and Dr. Chen want to remind everyone colon and rectal cancer is real in young adults. And for anybody who believes they have symptoms, make sure to see a doctor. Back to you, Jasmine.